Hello and welcome to this video on physician attrition with a focus on one of the more readily affected fields, oncology. Year on year, the rate at which doctors are either leaving medical practice permanently or having to take extended leave is rising. It now sits at about 40% of the total physician workforce, but 50% of oncology. Oncology is among one of the most desperately needed and highly utilized services. In the short term, burnout, or more appropriately attrition, can cause significant decreases in the number of physicians available. This can be due to acute health conditions or exacerbations of chronic diseases. This could be exacerbation of existing medical conditions or development of novel conditions such as hypertension. In other cases, the long-term effects of these stresses overcomes the physician's ability to cope. This leads to physical and mental symptoms. This phenomena is not so common as to be a distinct diagnosis, but it is within the problems that are related to the life and management section of the International Statistical Classification of Disease and Related Health Problems. This is a tool listed by the World Health Organization as used to figure out what roles in society and what parts of society relate to difficulties in getting by. Oncology itself is a high-stress environment dealing with patients over a long term. As you deal with a patient more and more frequently, you become attached to them, and as a consequence, the inability to resolve the issue begins to take its toll on the doctor or nurses. This leads to a high rate of attrition in oncology, and this is important for a number of reasons. The simplest of which is this: the time taken to train a doctor and then specialize in oncology is not insignificant. The loss of this time and effort is wasted when attrition occurs. Not only that, but the loss of well-trained medical staff. Nurses also fall into this category where training and specialization can lead to greater losses than the time and effort alone. And then you need to consider just how much of an expertise is developed in the time they've been in that role. Losing that on top of the simple medical expertise is a major loss. The loss of a doctor will also deprive another possible student of the opportunity to become a doctor if proper care is not taken for those who have been accepted into medical school. Across the career path of an oncologist or even a nurse, burnout appears to be common at all stages. This means attrition is not just occurring in those who have been working for a long time or those who are new. To quote one source, "There are some unique circumstances in oncology because of the severe nature of the disease. In many cases, it is the inability to cure the disease, as well as handling the toxicity of various treatments. The toxicity of some treatments we have are worse than the disease itself and can lead to an oncologist feeling repeatedly helpless. With any luck, the developing technology in treating cancer may help with this particular issue. But then again, other technologies are taking their burden as well. And one of these is the effect compounded by the additional administrative burden of new technologies, such as electronic health records or medical records. These can increase the work required to maintain appropriate records for a patient, and increasing the work can create problems in and of itself. Every additional hour per week spent on these sorts of tasks can increase the risk of burnout by 5%, or at least among private practice oncologists. For those who are working either in public or from home, have a 3.5% increase in their risk of burnout. This higher rate of attrition is preceded by an increased rate of errors and mistakes. These range from simple recording errors to mismanagement of care, and as a consequence you can see how the high attrition rate, particularly in oncology, could have carry-on effects to patient-centered attention. All of this is occurring despite high career satisfaction levels, and it means there is an increasing effort towards supporting oncologists. Although they may enjoy their role, they are unable to continue to work in that field if they can't manage to make some sort of headway. And while oncology is by no means the sole field in which this is occurring, it does exemplify the problems. Thank you for watching this video. If you have found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions below.